cost, expense reduction is the
Right.
primary, I don't know if I would say driver, but rather challenge that not only supply chain leaders have, but health systems have. Simply put, revenues are decreasing, expenses are
Mhm.
increasing, but they have to reduce costs in an environment where they have a lot of turnover of their staff. They're getting pressure of reduced expenses.
Welcome to Health Pulse, conversation with leaders, improving how healthcare really works behind the scenes. Hello, everyone. I'm Drupal Patel, and today I'm joined by Angie Haggard, CEO of RDA Healthcare Supply Chain Services. Angie has spent nearly almost 3 decades in healthcare supply chain, consulting with systems across the country and helping organizations operate more efficiently while keeping patient care at the center. So, welcome, Angie, and great to have you on our show. The first
Yeah.
question, where are you calling in today from?
Thank you so much for having me on the podcast today. I really appreciate it. I'm actually dialing in today from East Tennessee, where it is a balmy 20 degrees today.
Awesome, awesome. Before we jumped in, what's something you enjoy doing when you are not thinking about supply chain? I know you've been doing around the supply chain more than 3 decades. What are you enjoying other than just, or well, you are not wear a hat of CEO.
Yes, in spare time, I definitely join hiking and playing the piano, music, anything music.
Awesome.
Yes, yes.
Great, great, great. So let's go back a bit. What first drew you into supply chain and when did healthcare become the focus?
Great question. So actually, when I first started in supply chain, I'd always didn't really know. I knew I wanted to do something in business, but had no idea what, as most of us do in our early 20s. And after having the opportunity to work at Walmart as an internship at their corporate headquarters and just see all the fascinating things about supply chain, I thought, okay, this is my cup of tea. I love this. This is amazing, and had the opportunity to work in supply chain and across different industries outside of healthcare. And growing up, one of my parents was always in the hospital as I had various illnesses and things. And I saw an opportunity. I thought, you know what? This is broke. Something's broken here. How much different could healthcare be versus any other industry? I could take my supply chain knowledge, the little bit that I do know, and try to make it a better place in healthcare. And had an opportunity to start with Owens and Minor as one of the largest medical surgical distributors. And I had zero knowledge of healthcare. Zero, zero. And I found out very quickly in the first day and walking through the warehouse, it's extremely different than any other industry that I had worked
Right,
in, high tech, retail, all of
right.
the above. And so, needless to say, I was fortunate to spend really 2 years in the belly of the OR learning all about healthcare supply chain, and just I've been, addicted ever since to
Right, right.
just really have that passion for making healthcare better one day at a time. And even though supply chain specifically doesn't provide direct patient care, I am a firm believer that what we do in healthcare supply chain does make a difference in making sure the clinicians and physicians who are taking care of the patient at the bedside have the products that they need at the right time and in the right place.
Awesome. That's a great way to put it. Right. And you work across retail, distribution, and the healthcare. What did those earlier industries teach you that you still rely on today?
Several things. One is that data is extremely important and helps you to make decisions. But at the same time, there is always an art and a science that must be applied collectively, not just myopically of just data only, or not myopically of just the art aspect of it either. And so that was definitely one element that I learned early on. And then the second element was the criticality of the importance of managing inventory. As we think about in our day to day lives in our own houses, we don't always care about what's in the pantry on a daily basis. and quite frankly, take that for granted a lot of times until
Right.
as of recent. We may have a snow or ice storm impending in an area that doesn't have a lot of snow plows or
Right. Right.
for that. And reality is that's every day in healthcare. If you do not have the right inventory, someone's life will be impacted. And
For
so
sure.
understanding the criticality and importance of inventory and how much of a role it plays in managing it effectively early on, that really translated across the industry, that and the data and being able to have the visibility, what is being used, what is being purchased, etc., is really also critical to not only making decisions, but also charting a path for the future and planning proactively.
Awesome. And I appreciate how honestly you are framing that and kind of transparently you are sharing this detail. So really appreciate it. And you stepped into the CEO role after years of consulting. What's changed the most in how you think once you were leading the entire organization?
From a healthcare industry perspective, one of the things that's been interesting to see over the past several years is that, no surprise, health systems have gone through many acquisitions over the past several years. So there are definitely fewer health systems and hospitals out there. But what has also been, from my perspective, the most amazing transformation during the past several years, even if we look at the 2016, 2018, 10 years ago versus now, the role of supply chain, specifically in healthcare, has changed dramatically. When I first started in the industry, before it was even called supply chain, it was called materials management. And
Right.
it was literally the physical movement of supplies. That was it. Then the
Right.
role of the supply chain leaders, specifically in the hospitals, really, and the physicians, the clinicians, the department leaders are really operating autonomously, not always, but for the most part, in regards to contracting and inventory management and the things that supply chain manages today. And over time, the role of a supply chain leader has really expanded from just moving boxes, and I don't even like that term, just moving boxes, but moving supplies, moving equipment, because it's so much more complicated than just moving a box. But from moving supplies and equipment, that role has transformed to now they have responsibility for contracting, and not just of supplies and equipment, of purchase services that are anything that's purchased by the health system in a best practice scenario should be funneling through supply chain. That way they are taking care of so they have the regulatory, working with regulatory teams, IT teams, making sure
Right.
all the things and check boxes that need to be checked off
Exactly.
to protect not only the patient from a safety perspective, but also from a regulatory perspective for the organization, finance perspective for the organization. So their role, the role of supply chain leaders, has really significantly expanded over the past 10 years to that of contracting, but now it's expanding even more to physical movement of supplies, equipment. You have contracting, you have value analysis structure or in procurement. But oh, by the way, now we need to incorporate master data management. And
Right.
what is our strategy as an organization? We have an IT department, we have IT leaders. However, making sure there are foundational elements. Is there enough bandwidth on our Wi-Fi inside the organization? Do we have protections and policies in place to have our expectations documented as an organization? And so that role of supply chain is continuing to expand and grow. And so as a result, the expectation of that role has really transformed significantly over the past 10 years. And on top of that, it's a little bit of a challenging situation at the same time, is the majority of those individuals in the supply chain leader roles of health systems at or on the verge for them. There was a study done a couple of years ago of retirement. So there's a lot of turnover that's happening right now in that role. And post-COVID, because some of those roles are transferable across industries from specifically, like, for example, sourcing and contracting. Yes, healthcare is different, but a lot of the other industries are starting to snatch up individuals from healthcare to those other industries. So they're also making sure there's a strong recruiter and have a good retention
Right.
for their teams as well.
Awesome. Means I don't think I hear this kind of perspective oftenly. So this is really great. Where do you see leaders feeling the most pressure right now in terms of it might be a cost, labor, complexity, expectations? What really driving it?
If there was a all of the above category,
That's what I want to say the next.
everything you just mentioned, yes, everything you just mentioned. First and foremost, cost, expense reduction is the primary
Right.
I don't know if I would say driver, but rather challenge that not only supply chain leaders have, but health systems have. Simply put, revenues are decreasing, expenses are
Hmm.
increasing, and that's from a business lens, we all know that's not a good combination. And so
Exactly.
it's first and foremost. And what's so yes, they're in a the big one of the biggest challenges is the reducing costs, but they have to reduce costs in an environment where they have a lot of turnover of their staff. And then the third part is looking into the future into 2030 when the forecast of the silver tsunami and this massive where the baby boomers are going to be, it'll be more individuals at retirement age than younger individuals. And so trying to prepare for that and make sure they have processes and foundations in place all the while they're getting pressure of reduced expenses. So that's where I'm a strong believer that AI specifically and technologies used in the right way, right? Just because we automate something doesn't mean it's a good thing. We automate
Right.
the right things and in the right way. That's so critical. And those organizations who are not taking time, which time is extremely valuable for these leaders,
Right.
not taking the time to plan for the next 5 years now, or 4 years at this point in time, are really going to be those, not just the leaders, but the organizations are really going to be in a challenging situation by 2030. So they really have a challenging role because they're getting hit from multiple directions for these hurdles to overcome.
I agree. I agree. Yeah. And since we are talking about the pressure, the challenges here, you work across the organizations, and what's
Mhm.
most common friction you see, the thing that quietly drain more time or energy, even it's well-run system?
I would say the things that probably drain the most time from them, ironically, is they're that managing the team and making
Okay.
sure there is not only, when I say managing the team, that's managing their direct reports and indirect reports, but it's also managing the politics
Right.
the spectrum, because in order to decrease costs, leading organizations are not just picking up the phone and calling a vendor to say, give me a 10% discount. That's the absolute worst thing you can do. And so
Right.
and so, in order to have you need to build relationships with your team internally, but you also need to build relationships with your leaders internally, and getting buy-in, getting support from your physician stakeholders, your service line leaders, but also from the executives inside the organization. And then also with your key vendors and partners, supplier partners, to build those relationships on all aspects. So from what takes the most time, that's really the majority of a supply chain leader's day and week and year is taken up by those managing those relationships and building. When I say managing the team, one other element I would like to point out, because it's often overlooked, is building a succession plan. So it's
Mhm.
just one person doing all the things I just mentioned. It's a leader delegating and growing that next generation in elevating them into those future roles as well. So it's manageable and achievable.
Right. So as a supply chain leader, I think you interact with mostly everyone and try to build a rapport. I think that takes a kind of time. And then, as I mentioned, I mean, second thing is to have a good plan in place and the team and to delegating the work. So I agree with that. And earlier you mentioned when we had a quick chat that expanding support into non-acute and veteran facilities. What tends to make that harder than people expect?
Yes, from a supplier perspective, what makes it challenging to expand into the non-acute areas as a supplier, unlike hospitals, these non-acute facilities, an ambulatory surgery center, a physician office, a clinic, etc., they are spread out all over the country, as we know, as our hospitals, but the difference is the infrastructure typically is not the same as a hospital. So instead of reaching 1,000 people in 1,000 hospitals, you may have 10,000 people to reach in a non-acute facilities. And so building the awareness of your company and what your services are, you really have to think about your marketing strategy much different than you would in an acute setting and acute supporting acute clients. Part one and part two, it's not just the marketing, it's even also the messaging of description of your services. One of the things that we discovered very quickly, as I mentioned earlier, early on in my career, hospitals were talking about materials management. Well, there isn't a supply chain team typically in a non-acute facility. It may be a part of the week, and that same clinician, the other part of the week is making sure he or she's placing orders and fulfilling all the needs. And then it may be an administrator who is negotiating a contract with the supplier. Even the term supply chain is not as prevalent in the non-acute. So making sure you really understand as a supplier, making sure you understand the terms you may be using in the acute setting could be completely different in how you message your product or service in the non-acute setting.
And as a leader, you lead this organization from the supply chain perspective. So when initiatives slow down, is it usually like a process or people or visibility into the data that creates a bottleneck? Do you see one of those factors, or other than those three factors, you see that any initiative slow down in this whole industry?
From an execution perspective,
Perspective, correct. Yes.
it's interesting. It's the most simple things that, sink a ship, right?
Right.
And so it's really no different in healthcare. And that is one of the things that is common in healthcare or other industries is across industries is that typically the things that slow down or impede an initiative from getting implemented really boil down to three things. One, is there buy-in and agreement with
Right.
not necessarily a title of a person who can, a C-level. You may have an unofficial influencer who you didn't even know about in the organization that is really connected to this XYZ initiative. And that person can really veto everything
Right.
that may be going on. So truly knowing who the individual stakeholders are and
Hmm.
official and unofficial influencers. That's first and foremost. And two is the data to make the decision and a process to make the decision. We find so many times the process to make a decision in these organizations, healthcare organizations specifically, there may be a process. It may or may not be followed. And if there's
Okay.
a process, it may be subjective versus subjective and quantitative, AKA back to the art and the science. And so
Right.
that not so much it's outside of the control of the vendors, and it's sometimes even outside of the control of the individuals inside the healthcare organization of not really understanding of, okay, we're at a stall point here in this decision process or implementation process. I don't know who to go to or where to go to get to the next step because I might need to get to the next step by going outside of supply chain and going to another group that I don't have a relationship with currently. So that's also a hurdle that can delay or prevent something from being implemented. And the third, and I don't know, I would say it's definitely not the least, but is communication. And it sounds so simple, but they're definitely the cause
It,
of
correct.
disease delay.
Right. It plays a vital role.
Yes, there's so many emails. And quite frankly, we have interims in place at a lot of organizations. And I'm glad that we do because it helps to make sure we stay current with awareness of what it's like with the shoe on the other foot.
Hmm.
And what I mean by that is if you're on the outside of a healthcare organization looking in, we have no idea how many emails a person and specifically a supply chain leader or a physician get a day. You can range anywhere from 1,000 to 2,000 a day. And we know that is just not humanly possible to look through that
Right.
many emails. And so that communication could be communication from the supplier to the healthcare organization. It's also communication inside the healthcare organization. So it's not just the supply chain leaders that get and professionals that get those amount of emails. It's all over. So making sure there isn't not only just effective communication, don't just send an email and assume that it's received. It may have been received and not rejected, but they may not have read it just yet.
Right. Right.
That's part
Exactly.
that then that communication and process for implementation is critical to make sure it happens. It's so simple, but yet very
Yeah.
difficult at the same time.
No, thank you so much for sharing that insight and walk us through those actually genuine and like a practical, I would say, like the real challenges, you know. So if you look ahead 12 to 24 months, what would success look like for RDA?
What would success look like for RDA in the next 12 to 24 months? I would say a couple of things. One, our mission is to enhance the healthcare supply chain. So expanding the support that we're providing not only to acute, but also to the non-acute facilities. It was
Hmm.
very apparent during the time of COVID how little support the non-acute facilities had. So making sure those facilities are supported with what they need from a supply chain perspective and contracting perspective. But also, we have a supply chain academy and making sure that individuals, whether they are brand new to healthcare supply chain and they're working inside a hospital, whether they are working for a manufacturer. I remember we want them to be aware of the training that's out there because I remember when I came into healthcare and I thought, how hard could it be to understand this industry? It is a
Right.
as you well know, it is a whole different language and
Exactly.
acronyms that we love in healthcare. And so expansion and just awareness of our supply chain online courses that are out there for individuals and they're also for companies as well. But we really wanted them to be structured in a way that anyone could get access and take them. So those two things. And last but not least is continuing to build our own bench and strength as well for that next generation into supply chain.
Awesome. And this is my last question. Hypothetically, if you had a magic wand to fix one constraint that's slowing down the impact that you want to create, what would you or what would you fix that one thing?
The magic wand, one thing that I would fix, not only for our clients and potential clients, but also selfishly for myself and our organization, would be a solution that would help to sift through these 1,000 emails plus and identify which ones you should really look at and
Right, right.
prioritize because and in all seriousness there's so many not just RDA there's a lot of companies getting connected to the decision makers is a very big challenge as we all know, and I think a lot of times there's a lot of new innovations that are out there that hospitals and health systems and acute and non-acute miss out on simply because it's buried in the email and
Exactly.
or through the relationship they miss out on that opportunity, and which is very unfortunate because there's a lot of solutions out there that are needed and are needed desperately, and there are various channels to get to them, and really building the relationship is the way. But if there was a solution to help out with those emails not for everyone that would be utopia.
Right, right. No, thank you so much. And for healthcare leaders listening this, what advice would you give them if they want to strengthen the supply chain without burning out their teams or their efforts?
One of the things that I would highly recommend is listen to your teams and the ideas that they have, the ideas that they are bringing to the table. And number two, don't be afraid to ask for help outside of your team. The what we see, and I'm not just saying this because RDA provides supply chain services, it's really for anything that you're looking at. We have found, and not just we as RDA have found, but it's a proven fact when you pull the greatest minds together to solve a problem, you're going to get to the solution much quicker. So having an open mind and willingness to listen and get others to help out to expedite the results definitely is an indicator of those organizations who are advancing down the spectrum and to best practice much more rapidly.
Okay, thank you. And where can people learn more about RDA and the work you are doing? What is the best way to connect or to search RDA?
Certainly, our website is www.rdahealthcare.net and would welcome you to reach out on that website. There's a contact form there, as well as happy to share our email and information separately also. But would welcome any conversations, or even if it's just questions about the industry in itself, happy to help and connect.
Awesome. Angie, this was a fantastic conversation. You brought such a grounded, practical perspective to an area that doesn't get enough spotlight. For me, this is the very first time that I'm learning a lot for supply chain perspective. And thank you for sharing your story, your insights. Really appreciate your time.
Thanks for having me. It was an honor to be on and really look forward to hearing about some of the other podcasts coming up as well.
Yes, we'll do. Awesome. Thank you. And we're signing off now.
Okay. Have a great day.